Nasal polyps are soft, painless, non-cancerous growths on the lining of your nasal passages or sinuses. They hang down like teardrops or grapes. They result from chronic inflammation and are associated with asthma, recurring infection, allergies, drug sensitivity or certain immune disorders. Small nasal polyps may not cause symptoms. Larger growths or groups of nasal polyps can block your nasal passages or lead to breathing problems, a lost sense of smell and frequent infections. Nasal polyps can affect anyone, but they're more common in adults. Nasal polyps are associated with irritation and swelling, inflammation of the lining of your nasal passages and sinuses that lasts more than 12 weeks, chronic sinusitis. However, it's possible to have chronic sinusitis without nasal polyps. Nasal polyps themselves are soft and lack sensation, so if they're small, you may not be aware you have them. Multiple growths or a large polyp may block your nasal passages and sinuses. Common signs and symptoms of chronic sinusitis with nasal polyps include a runny nose, persistent stuffiness, postnasal drip, decreased or absent sense of smell, loss of sense of taste, facial pain or headache, pain in your upper teeth, a sense of pressure over your forehead and face, snoring, frequent nosebleeds. Conditions often associated with nasal polyps include asthma, a disease that causes the airway to swell, inflame, and narrow, aspirin sensitivity, allergic fungal sinusitis, an allergy to airborne fungi, cystic fibrosis, a genetic disorder that results in abnormally thick, sticky fluids in the body, including thick mucus from nasal and sinus linings, Churg-Strauss syndrome, eosinophilic granulomatosis with polyangiitis, a rare disease that causes the inflammation of blood vessels, vitamin D deficiency, which occurs when your body doesn't have enough vitamin D. Prevention: you may help reduce your chances of developing nasal polyps or having nasal polyps recur after treatment with the following strategies. Manage allergies and asthma. Follow your doctor's treatment recommendations. If your symptoms aren't well controlled, talk to your doctor about changing your treatment plan. Avoid nasal irritants. As much as possible, avoid breathing airborne substances that are likely to contribute to swelling or irritation in your nose and sinuses, such as allergens, tobacco smoke, chemical fumes, and dust and fine debris. Practice good hygiene. Wash your hands regularly and thoroughly. This is one of the best ways to protect against bacterial and viral infections that can cause inflammation of the nasal passages and sinuses. Humidify your home. Using a humidifier may help moisten your breathing passages, improve the flow of mucus from your sinuses, and help prevent blockages and inflammation. Clean the humidifier daily to prevent bacteria from growing. For doctor's recommended solution, visit the link in the description.